Hello and welcome to Pisgah Health Today. My name is Angela Owen and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. We have 2 very special guests today representing the Irene Wortham Center. We welcome Matthew Henry and Sydney Reichert to our program today. Thank you so much for taking the time to be with us here.
Thank you.
Matthew comes from the Pennsylvania area, so we are proud to have him now here in North Carolina. He has degrees from both Penn State University and Eastern, and he, in a prior career, taught health and phys ed to K-1 through 12. He's been in the nonprofit world for about the last 25 years, with the last 6 of those being at the Irene Wortham Center. He's married, 2 boys, 23 and 25, and of course, has that wonderful 4-legged animal, the dog, at home as well. So welcome again to our program today. Sydney is the Marketing and Development and Marketing Director. She comes with some background. She was prior to this at the Foothills Area YMCA. And one of the things I discovered when researching Sydney's background, she hiked the entire Appalachian Trail. That says so very much about you, Sydney. So exciting just to have a few moments before we did this interview to talk about some of those experiences. Her educational background is from Miami University, where she comes with a mini MBA and a bachelor's as a marketing major and an analytics minor. Again, welcome to Pisgah Health Today. And Matthew, why don't you start by telling us just a little bit about the Irene Wortham Center?
Sure. The Irene Wortham Center has been in Asheville for going on almost 60 years now, about 58 years. And we support folks that have intellectual developmental disabilities or developmental challenges. So we have anywhere from kiddos that are 6 weeks old in our early learning center program to folks that are probably almost 90, either mid to upper 80s in our adult day activities program. So a lot of our folks are nonverbal, but they definitely express themselves and what they want and need. So that's always fun to watch and see. And really what we try to do is help folks find the most independent lifestyle that they can have and to make the most choices that they can. So just a quick example, if somebody is nonverbal, what we would work towards is maybe them using hand signals or finding ways to communicate that, hey, I want to go outside, I want to eat this, I want to choose that. So we really want to promote independence in folks that have not had the choices that they normally folks have in normal life daily activities. So I think the second thing is with our folks is we really want to get them out in the community, because some folks have never experienced spending some time with a person that has a developmental delay or disability. And sometimes for folks that can be a little bit scary because they don't understand what's going on with folks and why they may make noises or why they may look a certain way or sound a certain way. So once they get to know people and they get to know that they really are just like you and I and really just trying to express themselves and their needs and wants, that really helps the community come together to help support folks like we have in our programs. So we're always out there getting people in the community when we are allowed. Obviously with COVID, that's kind of slowed us down a little bit, but we really want to get folks out there meeting new people and really getting to experience the fullness of life.
It's incredible to think about the dignity and value that you're demonstrating for these very special people as you're engaging with them and helping them find that independence and engagement within the community. I'm sure you could do countless stories of positive examples along those lines. That's amazing.
Absolutely.
Sydney,
and I would just add to that, in addition to serving the population with intellectual developmental disabilities, we also serve the low-income family population. 90% of the children in our early learning center come from low-income families, and we support them through the first 2,000 days of their life, which are vital. It's a vital time for early childhood development, and unfortunately, children from low-income families don't always get the opportunities that they need to develop socially and emotionally during that time. So I would say that's another really important mission that we strive for.
Great clarification. In addition, and building on that, Sydney, how has Pisgah Health Foundation helped you in achieving and reaching those missions?
So most recently, you guys really helped us during the onset of the pandemic. We received a grant from Pisgah Health Foundation around late April. And during this time, our school was going through a transition. Our early learning center was. We had to suspend our regular enrollment. And so we typically enroll children ages 0 to 5. And like I said, from low income families and also with developmental disabilities. And we had to suspend that program. We typically have 100 children. That's our capacity. And we started enrolling children ages 0 to 12 whose parents were considered essential workers. These are folks that needed to continue working throughout the pandemic. And the challenge that we were faced with was a cutoff revenue stream because we were operating at a lower capacity, but we had the same level of expenses during this time. So the grant that we received from Pisgah really helped us be able to keep this essential worker program going and support the populations that really needed it during that time at the beginning of the pandemic.
It's encouraging to hear that you were able to keep this thing moving and not, COVID certainly changed things, but it certainly didn't stop things for you along the way.
Sure.
I love it. Well, I'd love to field, and I'll let each of you have a chance to just really chime into this. And Sydney, I'll start with you. And how can people come alongside and support the work that you're doing and get involved? And what else would be important to share with our audience?
Yeah, so typically in non-COVID times, there are lots of in-person volunteer opportunities that are available. You can come and read in the classrooms to the children. Sometimes we have volunteers come in and host activities with some of the people in our Adult Day Activity Center and our residents. Looking into the future, there could be opportunities for teaching some wellness classes such as yoga and weights from volunteers in the community. But that's all non-COVID because currently we can't have any visitors. Where there are definitely ways to support us now. And to be quite frank, most of them are financial contributions can really help us continue to address COVID related needs as they arise. I mean, keeping the individuals in our program safe is our top priority. A lot of them are high risk as it is. And so it's imperative that we keep them safe during this time. And that just comes with a lot of expenses related to PPE, related to our payroll, because we're operating at lower capacities in most of our programs. So we have that cutoff revenue stream. So monetary contributions are always going to be a huge help. We have our golf tournament every year. This year will be our 21st annual golf tournament, which is exciting. We're still figuring out the details for the date and the location, but we're looking sometime around June or July, hopefully. So you can definitely find more information about that on our website, and it will be promoted once we have those details nailed down. But that's a fun way to support us. And our website also has all the other volunteer opportunities that happen on an annual basis. For more information, you can look there.
I'm sure by then people are going to be more than ready to gather with their friends on the golf course and have some fun together.
Hopefully.
So absolutely. Matthew, what would you add to what Sydney has just described, and what else would be important for our viewers to know?
Well, and as the saying goes, it takes a village. So I think for us, one of the things is, and people did a really great job over the holidays. We weren't able to have a traditional holiday party this year, but we had so many people volunteer to give us items, whether it be gift cards or a special gift for our employees to support them, because they truly are heroes in this situation, working with folks and putting themselves at risk day to day. So I think even just a note or anything that they can do to help us out as we encourage our employees. We're constantly trying to get them little surprises, like we'll have lunch for them periodically, and just things to keep them going during this, as well as to our consumers, whether it be a little a snack, an extra snack, or a gift as a donation. It just lets them know that people know that the work that they're doing is important. So I think for us during this time, any little things that we can do to make both our consumers and the folks that work here feel supported would be helpful.
Well said. Well, on behalf of the Board of Directors of Pisgah Health Foundation, I would like to thank both of you, along with your staff and all of those who are working behind the scenes so diligently at the Irene Wortham Center to make such a positive difference on the lives of so many Western North Carolina residents. We are super grateful for the work that you're doing, and I want to thank you both for taking the time to share a little bit of your story today with us here on Pisgah Health Today. It's been a pleasure just getting to know a little bit, and hopefully we'll have the opportunity to come learn more sometime in the near future when we can safely be back together.
That sounds great. Please.
Yeah, that sounds great.
Thank you again. We also want to thank Wildflower Media for their creative and technical support, along with the Board of Directors and staff at the at Pisgah Health Foundation and the Physicians Roundtable. If you would like to hear more stories like these and support other stories, let me encourage you to go to pisgahhealthinsider.org and join the movement. Until we see you on the next Pisgah Health Today, stay well and be well.